So I'm just going to wrap up the last few slides. Hopefully you all got to watch my longer slide on cardiovascular blood pressure regulation. There's not too much in the remaining slides that'll be fair game for the test, just a couple of things. First, I'm going to talk about the response to light exercise and then heavy exercise, and then just wrap it up with a few more things, including like the liver blood flow, because that's such an important organ for pharmacists to understand. So first of all, light exercise, when you do that, you have extensive vasodilation in certain areas, and that is things like skeletal muscle, and even during heavy exercise, which we'll get into in a minute, you'll have quite a lot of vasodilation. I want you to understand that that is epinephrine and beta 2 receptors. That is not norepinephrine. Norepinephrine will be released, but what that will do is restrict blood supply to the secondary or organs of secondary importance when you're exercising, such as the kidney and the GI tract and things like that. The other thing that norepinephrine does is it speeds up the heart rate and increases cardiac output, as well as epinephrine does that. So venous return increases with your muscle contractions, cardiac output rises through the Frank Starling principle, and the atrial stretching, that atrial reflex causes an increase in heart rate. Heavy exercise is pretty much the same idea. A cardiac output can get up to 4 or maybe 5 times the resting level. And please understand this is even more important now during heavy exercise, that you're restricting blood flow to non-essential organs. Non-essential meaning non-essential while you're physically active. And I guess if you had to like place a reason on it, why would the body evolve that way? I guess the reason would be that you need to put more energy into moving, especially if it's for survival. I think historically people didn't necessarily exercise as much for fun as they did for survival. So you don't want your energy and blood flowing to the kidney and the digestive system when you're trying to escape a bear or something like that, right? So alpha 1 receptors in norepinephrine are going to, and epinephrine are going to restrict blood flow to those organs. We're going to redirect blood flow to the skeletal muscles, lungs, and heart. The lungs also have beta 2 receptors in the smooth muscle. So blood vessels, and this part is FYI, but the lung tissue, the actual parenchymal cells or the functional tissue, also, I'm sorry, the smooth muscle there, it can cause relaxation or dilation of the lungs. So not only the blood vessels in the lungs, but the actual muscle that's allowing the lungs to expand and contract. That's going to, and that's the bronchial smooth muscle. That is going to basically dilate and allow you to breathe better and get more oxygen, because the idea is that you're physically active, so you need more oxygen. And then blood supply to the brain, you should already know that that's not affected. It should never be affected by things like exercise, because you're still going to need energy there. So this is just a summary of the different organs, how cardiac output changes or tissue blood flow changes. So as you can see, exercise has a dramatic effect on blood flow through the coronary arteries. That's why it says heart. That means the actual blood flow right into the arteries, like I said, coronary and then the coronary veins and all that, or cardiac veins. The brain doesn't change. Skin changes to get rid of heat. Kidney goes down because it's a waste of blood flow at that point, because there are more important things to be doing than making urine. The abdominal viscera, that means small intestine, large intestine, liver, etc. And then total cardiac output can get much, much higher during strenuous exercise. These are some interesting things. This is FYI, but what does training do on cardiovascular performance? The weight of a person's heart could get significantly larger if you are, a trained athlete. And it is true that if you are abusing, physically, is essentially physically pushing yourself to your limit all the time, and For example, if your heart rate is always at its max, and you're not exercising at a healthy amount or rate, you could actually cause too much muscle growth, hypertrophy of the heart. So exercise can be overdone and can harm the heart eventually, chronically. Stroke volume goes up with a trained heart. Heart rate should go down because the heart is more efficient. Cardiac output is going to be at rest, is going to maybe go up a little bit, but primarily during exercise, it's going to be much, much higher. Um, Blood pressure is not very different, assuming a non-athlete doesn't have any comorbidities that would affect their blood pressure. Otherwise, it's pretty similar. And yeah, when you're exercising, your blood pressure, specifically the systolic, goes up significantly, whereas the diastolic doesn't change as much. Okay, I just have a few more slides on on the hepatic portal system. So this is switching gears a little bit. The only reason why I like to talk about this now is because of how critical it's going to be to understand what happens to nutrients and medications when they are ingested orally. So there's a very specialized system called the hepatic portal system. The hepatic portal system is unique because it's not just a single capillary bed. It is two different capillary beds. So what it is you have your kind of your normal one, which is where you always have the initial capillary bed that comes after the arterioles, and that would be, for example, in your large intestine, small intestine, stomach. That capillary bed delivers oxygen and things to your GI tract, but it also actually allows you to absorb food and drug molecules. And your body handles anything that you're ingesting. It kind of handles it the same, almost like a nutrient, unless it's toxic, and hopefully then it doesn't allow it in. But that's not always the case. But the point is there that you're getting the drug following kind of the normal path of a nutrient, which is unique there because the portal system is then what happens is the medication goes into the blood, into that initial capillary bed, and then it travels to something called the portal vein. The portal vein takes everything, all that blood, to a second capillary bed, which is actually in the liver. So that's called the hepatic portal system. So please understand, it's two capillary beds separated by the portal vein. So almost, and this is not 100%, but almost every drug will go through the portal system to the liver before it gets to the rest of the body, and that's why it's called first pass metabolism there, because the liver gets first dibs on orally ingested things for the most part. So it delivers, going back to actual just regular physiology, it's delivering nutrients to the liver to be processed. Okay, so starts capillaries and digestive organs, and then it ends at the liver capillaries, which are called sinusoids. Remember, those are the leakiest capillaries because they have actual gaps between the cells. This is FYI, it's a lot of anatomy. Anything here that's really important, you won't be tested on the lecture exam. You'll be tested on it in the lab exam. And I have a study guide that'll tell you what to focus on. So most of this won't be on there anyway. I mostly want you to just understand what the portal vein is and where it is. So I wouldn't be too concerned. If you're interested, these are some of the names of the veins that basically feed the portal vein. So these are coming from the large intestine, the spleen, stomach, etc., gallbladder. So again, it's just something you could kind of look more, if you're interested, look more into it. So when blood reaches the liver, what happens is, first of all, it could go into the hepatocytes and get removed through the bile. That means not the blood, but the components of the blood. So drugs, nutrients. However, some of that blood will not lose the components, and so some of the components will go right through the liver, right through the blood, percolate through the liver, and not actually cross into the hepatocytes. And that'll go back actually to the hepatic vein and then the vena cava, the inferior vena cava. Critical. This is critical to understand that the hepatic portal vein is not your regular hepatic vein. So the portal vein goes to the liver. The hepatic vein, just the regular hepatic vein, leaves the liver and goes back to the heart. So the regular hepatic vein is functioning like any other vein. The portal vein is special because it's in between digestive organs and the liver. So after all that talk, I think it's probably a lot easier now to understand what this is all about. This diagram here. So I'll just start with kind of a random portion. Just for instance, the small intestine is going to pull nutrients, right? Pull nutrients from the capillaries, from the food into the capillaries, then into the veins, and then it'll go all the way to the main portal vein, specifically the hepatic portal vein, and then it'll branch out and percolate through the liver into the very small sinusoids that are, again, leaky. Some of that will go in actually into the liver cells and then go out the bile, which you're not seeing on this diagram. But a lot of it, a lot of the substances can also continue and then go into the hepatic vein. There's one example of a hepatic vein and another one, but then it goes back to the vena cava, back to the heart. So again, this is a double system, double capillary bed. So please remember that. And this is just the other side, just to make it a little larger. I separated them, but showing you the stomach, the spleen, the colon. This is another part of the colon, the end of it basically. But it's very simple just to understand that pretty much all the abdominal organs, they go in the blood will go right to the portal vein. And to make it a lot easier to understand, I think, is if you just think about the purpose. Pretty much these abdominal organs are involved in digestion. Okay, so they're absorbing and digesting nutrients. So that's why they're going to travel to where the nutrients need to get processed, such as cholesterol being synthesized in the liver, fatty acids being synthesized there. Actually, toxins from your diet, could even be microbial toxins, getting eliminated by the liver. Even non-microbial toxins like chemical toxins get to the liver first, okay, and hopefully we get rid of them before they reach the systemic bloodstream. So, to me, one of the interesting things is that if you put something in your cheek or under your tongue, which is sublingual, it does not go to the portal vein because your body is not designed to absorb nutrients in the mouth. It's designed to absorb nutrients in the intestine. So your mucosal membranes in the mouth bypass the liver. That's why you can use drugs like nitroglycerin. Very rapidly it gets into the blood, bypasses the liver, and can alleviate chest pain within maybe 5 minutes. So that pretty much wraps it up. Sorry I couldn't finish this in class, but and sorry I got it out there late because of the glitch that I had 3 times. PowerPoint failed me, so I finally got it wrapped up. So thank you for your attention if you made it to this point.